Good. Okay, this is the 10th of October. This is the Pitkin County Board of Health quarterly meeting. And I think we need to do we need to take a roll call, or do we don't really need a roll call, but we do have a quorum here, board members. And I'm going through the agenda now. We've got a lot to talk about. We've got round robin in there later for thoughts from the board, and we've got public comment at the top. First, I want to just check to see if there are any corrections or changes to the agenda. Or
from the posted agenda, I need to change just the title. Instead of 2024 communication plan feedback, it's 2025.
Thank you. I was really vexed over that. Thank you, though. That's good. So coming up next, do we have any comment on or corrections to the minutes from July? If anybody'd like that. If not, we could go for a motion to approve.
So moved.
First and a second. Okay, all in favor?
Aye.
Aye. All right, moving right along to public comment. Is there anybody in the room who'd like to comment on anything, honestly, and it's not on the agenda, or maybe is? It doesn't matter. Come on up. Yeah, you have to come up to a microphone.
Greg, we haven't had public comment in here in quite a few years. If you can just remind
how it works.
How it works.
Okay, so public comment, generally the public can come and speak on, usually on topics that aren't on today's agenda, but maybe in this case, I don't know if it matters. We limit you to 3 minutes. There's no one else here apparently, so you might give you a little slack at my discretion. And then the board we don't do question and answer or any of that. It's just a comment, and then we may take it up in our conversation, but that's just so we can keep it moving. But to give you a chance to be heard, and maybe it's something that ends up on an agenda or in conversation at another time. Okay, and you have to start by introducing yourself.
Hello. I don't even know if this is.
I think it's working.
Okay.
And if the red light's on.
Hello, I know so many of you. My name is Martha Hamill. I'm the co-founder and executive director of the Aspen Psychedelic Resource Center. And I'm here to briefly introduce our organization and ask for your support in collecting data so we can actually accurately understand community need around psychedelics. As so many of you know, Colorado passed the Natural Medicine Health Act last year, which decriminalized plant-based psychedelics for consumption, possession, gifting, and cultivation for adults 21 and up. It also paved the way for legal psilocybin clinics, which will open in January 2025. So before this board meets again, we might have psilocybin clinics opened up in Colorado. And Pitkin County overwhelmingly supported this. 75% voted in favor. It was 81% in the city of Aspen. So people are very pro psychedelics here. People are doing this. And it's really, psychedelics can be profoundly transformative and healing, and they can also be really destabilizing and dangerous. It's really important that people do this mindfully, and that anyone who's choosing to have a relationship with these medicines is able to effectively assess risk. So that's why Aspen Psychedelic Resource Center exists. We've been hosting educational events. We've done the Aspen Psychedelic Symposium with Aspen Public Radio for the past 2 years, nearly selling out the Wheeler Opera House. We offer community integration circles twice a month and one-on-one integration for those who are looking for it. We're working at developing a training for primary care physicians. So that right now, lots of people are coming into their doctors and saying that they're microdosing. We're really trying to make sure that the doctors have adequate education. And we're collaborating with organizations like the Hope Center Impact to ensure that there is support for people in psychedelic crisis. And we really need more data on what's going on. I have been in collaboration with Rocky Mountain Poison and Drug Safety, developing exactly how we're going to collect data and the questions, but I'd really love to see a community survey on use. what sort of contexts are people using in it? Are they using it for mental health, for spiritual purposes, for recreation? Are there patterns of misuse or overuse? How are teenagers interacting and understanding psychedelics? And are there concerns from anyone in the community? Have people been seeing problems? Which leads me to the next point of what we really need is a way to collect data on incident reports. Right now, the way that we are collecting data is somebody calls me or stops me at the grocery store or on the gondola and tells me a story about something that happened in town. And this is remarkably effective. I don't think I have time to tell a story, but there's a really important recall that actually started with one of these stories that happened locally. Right now, I can't collect private health information from law enforcement, from the crisis center, from teachers, from the hospital, but it's really important that that data goes somewhere. And I would love to collaborate with Pitkin County Public Health to figure out how to be able to collect and analyze any data of anything that's going on.
Great.
Yeah,
Thank you for
thanks.
that. That's food for thought. Thank you very much.
Thank you.
Thanks for coming in. Tell me your name once more.
I'm Martha
Mar-
Hamill.
Hamill. Okay, great. Thank you.
Martha, what's your background?
I have a master's degree in nutrition. Actually, I'm a nutritionist. I wrote my master's thesis on the intersection of emotional trauma, addiction, and gut health, which just dovetails right into psychedelics.
Great. Thank you for coming.
I'd like to briefly comment because I attended the 2 Aspen psychedelic conferences that were done at the Wheeler Opera House in the last 2 years. More than 400 people attending that. What is happening with the psychedelics is there is a kind of a responsible oversight going on as opposed to cannabis being sold in dispensaries without any oversight. Instead, there's a licensing board under DORA, the Department of Regulatory Agencies, that licenses physicians, nurses, et cetera, and is licensing this new category of natural medicine healers that will do oversight when the psychedelics are dispensed. And 2 weeks ago, I was in Denver at the North American Congress of Clinical Toxicology, where there was a full day dealing with psychedelics by psychiatrists and psychologists from the University of Colorado Medical Center, University of New Mexico. So there's a lot of credible stuff going on, but it's a dispersed field because you're not just dealing with mushrooms, but you're dealing with ayahuasca and other substances. So it's somewhat of a complicated matter, but I compliment Martha in trying to, she runs this 501c3 that is trying to give some education and oversight to it.
Great. Thank you for your comment. Thank you. We're going to move on, but this
Thank
is
you.
great. And I'm sure there'll be some conversation about it at some point, round robin or whenever we can bring it back. Thank you.
Thank you.
Thanks for coming in. Okay, I'm going to keep us, if there is no other public comment in the room, that people aren't tuning in online. I assume if they are, you'll let me know. Anybody?
Will there
calls
be a
in.
chance to discuss more of this?
I think
there
there, we'll have to, I think we can
Okay.
maybe devote round robin to it.
Comments, but I know. we're talking
Right,
about-
yeah, sure.
Okay.
Let's stay on track. Just gonna keep us on track, but I agree with you.
Okay.
Okay. You're not coming to make comment. You're part of you're part of our.
Just getting ready for the next part.
Got it. Okay, so we're gonna move into budget recommendation of the BOCC. Larissa's on deck.
Jordana
I
first.
can
Jordana's on deck.
So the Board of Health has the responsibility to review and recommend the budget to the BOCC. Our Board of County Commissioners will be reviewing the budget Tuesday. So this is a well-timed meeting to be able to bring it to the Board of Health first before it goes to the BOCC, who actually holds the ability to make the financial decisions related to the department's operations.
Excuse me, just a sec. Do you have the ability to turn on this monitor? There's probably a remote right there. And I don't see our regular IT people in the room for this, so just
Sorry
thinking
about
if we can turn that on just so we can all see what we're talking about. See if that helps. Maybe it will actually work. Yes.
we go.
Ta-da. Okay, thank you.
Perfect. So if we look at the next slide, we just give an overview again of our current organizational structure. We've got 16 regular, we've got 16 full-time employees in the department. 2 of those in green are actually term limited positions. And then Tom actually is not a full-time person, but he is a contract employee. And so you can see the 3 departments that we have are Larissa is Deputy Director in charge of our administration department. Jenny Lyons is the manager of our program Education and Partnerships. And then Kurt oversees our environmental health department. And for those just looking at seeing if Kurt does jump on, let me know. He just got released from jury duty over in Eagle County, so he might be back in time to present the environmental health part of the agenda. Oh, and that's great. Can we just see also who is on online as well? We've got Krista attending remotely. We've got Barry attending remotely. And the rest, Terry is public health staff, and I am on there as well. Great, thank
Great.
you.
Welcome, everyone.
The next slide is just a reminder as we go into thinking about budgeting and programming and all of the work of the public health department. It's always important to ground ourselves in the determinants of health and what are the components that we know impact health overall. And knowing that social and economic factors, of which make up 40% of one's health. Health behaviors follow at about 30%. And then what we spend a lot of dollars on, but potentially has a smaller impact is that clinical care at about impacting your health about 10%. Physical environment, genes and biology are also equal there. So I think, as we're reviewing and talking about public health initiatives and impacts, knowing that we've got some other folks on different boards and in charge of county and city and Snowmass Village budgets, knowing those social and economic factors are the most important thing. Education levels, how much income folks and families have that do impact health. Next slide, please. And now Larissa will present the administrative budget.
Thank you. So as Jordana mentioned with our organizational chart, we have kind of 3 sub-departments. So the administrative team is one of those sub-departments. So I'm just going to briefly go over some of our priorities and then kind of some of the key increases or decreases in revenues and expenditures. You can go to the next slide. So kind of our priorities for 2025. First, we will continue to focus on our public health improvement plan. And this plan, you may recall, was developed after conducting a community health needs assessment several years ago and includes targeted strategies around those 2 focus areas listed, pathways to care, including mental health, in which we're trying to help ensure that all community members have access to necessary mental health resources as well as healthcare resources. And in addition, includes strategies around climate change and health, in which, again, we're focusing on strategies around prevention and education. Our second priority is updating our biannual department strategic plan. And this will really be essential to align our goals with our current public health challenges and focuses. And this year, we're also really hoping to align our department strategic plan with an internal equity, diversity, and inclusion assessment. Third, we know that effective communications is vital for public health messaging. So continuing to invest in communication strategies that ensure timely and accurate dissemination of information, as well as to continue to build trust within the community, and especially next year, really focusing on partnerships and increased community engagement. And then fourth, our commitment to equity, diversity, and inclusion will continue to be a priority within the department. As I said, we're hoping to seek a consultant next year to kind of help us determine where to go next with our EDI efforts. And then finally, we recognize the importance of promoting a culture of belonging and learning within our department. So by investing in Employee development and retention strategies, we're really aiming to create an environment where all staff feel valued and empowered. And the next slide, I'll just briefly outline some of the key increases and decreases in revenues and expenditures. So the first, we have an increase of just a little bit over 56,000 from the Office of Public Health Practice and Planning and Local Partnerships from the state for our core public health services. On the other hand, we also have a decrease of about 13,500 from the same funding source, but a preventative block grant. This is kind of a separate grant that we've been applying for each year. And unfortunately, this year we didn't get as much as we did previously or as we had hoped. On the expenditure side, we will see an increase of just a little bit over 22,000 for payments to Eagle County Public Health and Environment. And this funding is specifically designed to provide women, infants, and children services to Pitkin County residents. And that is all of that. So I'll pause there before we go to the next slide and see if there's any questions or comments for the administrative budget.
I just have a
Liz.
question. Is the increase to Eagle County based on a per client basis?
Yes.
So Eagle County has been providing these services to Pitkin County. You probably remember Garfield County provided it, then it went over to Eagle, it was kind of back and forth for a little bit. They've been doing it for a number of years, and just the state does provide some pass-through federal funding to provide WIC services, but it's not enough to actually provide all of the services that are needed to carry out the program. And so Garfield County staff they come up and provide services out of community health services once a month.
Eagle County.
Yes,
Yeah.
thank you. Eagle County comes up and provides it out of community health services once a month. And then also any Pitkin County resident can access services during normal business hours in the Elgibel location, which is staffed fully. They have been doing this without charging us any of that difference up until now. Federal funds for the WIC program have decreased dramatically, and then WIC has also gone through a change in their funding formula, prompting us to look at the additional cost to the county to provide this service. And so how we determined this cost was determining how much it essentially costs per client for Eagle County to deliver this service. And we are paying for, I think we have on average about 50 clients that get services in Pitkin County per year.
I didn't realize that was the arrangement for WIC out of Community Health Services, the whole program has always been supported through Eagle County.
Not always,
Not
but
always.
in the last 8
Then they-
years, maybe. 8
Okay.
years, yeah.
I didn't see a category for epidemiology, which is
Oh.
a very important function.
Future slide. In the future.
It's coming. Was that your question? Or did you have another question also?
No, this,
That was it. Okay,
This is just the admin budget. That'll show up in the environmental health budget.
great. All right. Any other questions? Let's keep moving.
Okay, the next program area that we'll be talking about is planning, education, and partnerships. Going to the next slide, we can talk about the priorities for 2025. One is to continue working to retain and recruit staffing for the PACT, Pitkin Area Co-Responder Team Program. That we currently have 3 different grant sources to fully support that program. Implementing the PACT strategic action priorities. Though the strategic plan was just developed in this past year. So that work will be moving forward in 2025. School partnerships in Garfield County and Pitkin counties around youth prevention, intervention, and cessation is an exciting area that we'll be working on in 2025. This is really through our state tobacco education and prevention programming funds, which, spoiler alert, we have gotten an increase in those funds from the state. Strategic planning for mental health collective funding efforts. This is a big effort where we are bringing in a consultant to help us look at data, do some stakeholder engagement, and look at this collective funding that up to this point, Snowmass Village, City of Aspen, Pitkin County, the hospital and the school district, and there have also been Rocky Mountain Health Plans have put funding into a pot where we collectively support mental health services in the community where there are gaps. But we are going to be looking at where should that be going to get the best value for the dollars, and then also being able to coordinate with the number of different efforts that are currently going on. So I just signed the contract for that. That process will be starting here in the end of 2024, going through potentially June of 2025. One of the goals for this department is to extend the mental health data analyst position. That position supports a lot of this vital mental health services work. So we want that to at least go through 2025, so that whatever is indicated in the strategic planning for 2026, we can do accordingly, but need to continue doing the work as we continue on with the mental health work while we are strategically planning. And then finally, one of the goals here is to expand and grow community partnerships. So I think we've really, this current year, we took a big bite out of developing and strengthening our community communication plan. And I think we can still work to grow some of those community partnerships this next year.
Could you be more specific about partners? Sorry, Tori, I'll jump in after you.
No, could you be more specific about partners?
We sure can. So one of our goals is really something that we learned during the COVID-19 pandemic was that the way that we were able to effectively communicate and partner and get the message out to those parts of our community that were affected was by having the partnerships in the community with the right partners. So you never know what the next emergency is going to be. You never know what are the partnerships that are going to be crucial. So we really want to be able to do a scan to think about the partners in our community that can help us relay these messages and connect with different parts of our community. So we've learned during COVID, it was everything from working with ACRA and Go Snowmass to really reach out to and SkiCo to reach out to the tourism sector. Reaching out to ACRA also helped us with some of the partnerships with lodging and restaurant owners. We have also learned, depending on the communicable disease that pops up. So Mpox came, that was disproportionately affecting our men who have sex with men community. So knowing, having relationships with community organizations that already are a trusted partner in that community was very valuable. So those are the kinds of partnerships where we just want to kind of be able to do that environmental scan, understand who our connections are with especially disproportionately affected populations, and then continue to reach out, make connections, see, and let folks know that we are public health, what we're here for, and then knowing that what we know in emergency management is the relationships are crucial to have ahead of an emergency.
Great. And would RAFTA be on that list?
Yes.
Thought so. Great. Thank you. Is that, you got another one?
Greg is the newly appointed interim chair of RAFTA, so he's
Acting chair, yeah.
You're
Acting chair of RAFTA.
Perfect.
Talk to me
I
about
was
buses.
gonna say, obviously, I'm very interested in this work. Community mental health is one of the things that I've really kind of taken on as a primary champion as being mayor. And to that, I would highly recommend, if you don't mind reaching out to the behavioral leadership group effort that's going on out of the headquarters. just give them a call and include them in, let them know that this is even going on. That'd be great. They actually met today at noon. I wasn't able to sit in on that one. But I so appreciate any efforts in this direction. I do have to go. I apologize. I get to pick my son up from the bus, which is a treat. So I'm gonna go do that. If we circle back around at the end for roundtable discussion regarding psychedelics, I'm interested in that request that was about gathering data and getting some information around usage and any other concerns or questions from our community on that. So if you guys circle back to that, I'm definitely interested in getting more information about the state of psychedelics in our community before we start making decisions about how we're going to support or implement any of the state decisions that are being made.
Great. Thank you. Thanks,
Thank you
Tori.
so much. Bye, guys.
Don't forget the duck.
Listed. as
Yeah, that's
a-
awesome.
As a partner to reach out to.
Thank you.
Right, so potential proposed changes to the budget. We've got some revenue increases in our Behavioral Health Administration grant for PACT, up $106,000. In our STEP grant, that's the tobacco prevention work, is up $80,000. That is both for Pitkin and Garfield counties. And then this new department DOJ grant, that is in the first year, $125,000 for, again, supporting the PACT program. No expected decreases for this department. And then expenditure increases. Some of these correspond to the revenue increases. We're bringing money in. We also need to send it out. So the community cessation training is a part of that PACT, STEP work. The contractor to support the tobacco prevention work is budgeted, and then also for a mental health contractor for additional PACT field staff, and then also PACT data work.
Is that PACT field staff the second or the third employee?
So we
PACT
have
person?
two clinicians that each do different days of the week to be able to have 7-day-a-week coverage. I believe last I heard, we are still needing to hire for that second clinician position. We also have 2 peer specialists for the PAC program and then 1 case manager. So it's a total of 5 kind of field staff for that PAC position.
And this budget is to add yet another, or is this to help cover the existing cost of one of those 5? I'm trying to interpret is that a new body or is that a
That is a good
existing?
question. Let me look into that, Greg, and I can get back to you. It may take me a hot minute
Nope, you don't have to do it right now.
because Raleigh is on vacation and Jenny is out of the office. So I'll try to have an answer before the BSCC meeting on Tuesday.
Right, thanks. Yeah, we'll be talking about that again, right?
Kurt is just texting me.
And for those who don't know, and you all probably know this, but our PAC program is like the innovator and the first one in the state, correct? And it's a huge deal and it seems to be very successful and it's being replicated, I think, elsewhere.
I'll say I was at a Colorado Association of Ski Towns meeting in Durango recently, and they were talking about, they call it their core group, but it was co-responder.
Right.
But I was like, whoa, this is, we already have this.
Yeah, we've been there, done that.
Yeah.
Great, thanks.
Well, we can jump next to environmental health and I will begin and Kurt will potentially be jumping on here shortly. So the environmental health priorities on the next slide you can see for 2025. The first is around co-leading the Lincoln Creek work group. So Kurt serves as co-chair alongside Lisa Tasker. from Health
Health Rivers.
Rivers Board. Additional partners here are the White River National Forest, Colorado Parks and Wildlife, Roaring Fork Conservancy, Riverwatch, the CU Department of Arctic and Alpine Research, Independence Task Foundation, CDPHE, and then some private citizens. And the goal of that work group is really to address the water contamination up in Lincoln Creek. The group has worked to sample and monitor what is happening up there, and then they are hiring consultants to analyze data and then discussing potential mitigation. So that has been something that Kurt has really been devoting some time to this year, and it's expected to continue for 2025. A priority, we continue to request an air quality specialist. This has been a position, I can go back and look exactly, but I think it's like upwards of 7 years we've been requesting this position. Just in recognition of the additional opportunities and workload that are coming around air quality that Pitkin could be engaged in. So there is an airport air quality study that's happening that our department's currently supporting. But this position would potentially be able to take on that. And then also, as you heard about our priority in our public health improvement plan being climate change, air quality is a big piece of that. When we hopefully are able to bring this position in-house, we would be able to work on other projects like clean air shelters, expanded radon program, open permit program, and coordinating with regional entities on air quality projects. We have been notified that this is going to be put into the county budget as pending. So not necessarily in the budget, but pending what happens with the airport. We also in the past have recognized that by Tom Dunlop being able to do so much of our Smuggler Superfund site work, we can manage the workload. If he ever decides to retire, that will definitely increase the workload of the department and make this a position that becomes more necessary and critical. The other priorities are around updating on-site wastewater treatment regulations, OWTS, also known as septic systems. So the State Health Department does a triannual review of the OWTS regulations. It's an opportunity for our local regulations to be looked at and to engage the construction industry. We have to minimally align with the state standards that are decided every 3 years. And in some cases, we have additional, stronger regulations that are put into code. We also have to align with our local land use regulations. So this will be a lift for 2025. Finally, Dr. Kurt, something around epidemiology. The EpiTrax system is being continued to be rolled out, and the state is taking all of their different databases that exist and putting them into this one system called EpiTrax. In 2025, we still have a lead database and TBDB, tuberculosis database, need to be rolled in. So we know that this will take some time and effort in working out the kinks, but there are some real exciting possibilities when all data is one place and will allow for some consistency in data tracking. Finally, EPR is another huge category. So emergency preparedness and response. We continue to not only need to deliver on the state deliverables that are required, but internally, we want to find a way to be able to institutionalize all of those COVID-19 learnings. A lot of those are around partnerships and communications. So just making sure that we keep that somewhere in a way that is better as institutional knowledge than if our staff currently leave, and all of that is lost to history and time. And Kurt is here. Kurt, I will let you answer any questions and talk about the proposed changes to the budget on slide 15.
Questions, anybody? Questions? I just had a question about the climate, the climate aspect of the air quality. Is that just part of air quality, or is it, trying to figure out, one, is this specifically something that has to be done by a public health specialist, or is that something that, say, could be a contracted out thing to an organization like CORE that's focused entirely on climate and all the various aspects of it? Maybe not so much public health, but that might be something within their bandwidth to contribute.
Kurt, do you
So,
wanna take that?
yeah, can you hear me?
Yeah.
Yep, thanks.
All right,
Hi,
scrambling.
congratulations that they sprung you.
Yeah, thanks. A good question, Greg. So this is climate and health, which isn't something that CORE does. So it's really tying climate change back to how it will impact people's health, as well as then technical expertise around air quality. When we think of rules and regulations, there are a number of rules that we've gotten involved with over the years around air quality and changes to air quality at the state level. This will give us some additional technical expertise that's related to climate change and air quality, more on the, but again, on the public health side of things.
Great. Thanks for that. It reminds me of, regarding air quality and climate related issues, the schools that are transitioning to electric buses because they realize they can lower the asthma rates on their kids, and the stoves in people's homes going from gas to electric, same thing. People with asthma are looking at that, and at least I know people with asthma who are contemplating that to try to. So there are aspects there that are pretty fascinating. So maybe we just have an ally in CORE.
Yes, definitely an ally in CORE and other folks. And the co-benefits that you just highlighted are a great example of, even if we're working on greenhouse gas emissions, there's co-benefits to health with greenhouse gas emissions, not just thinking about the ambient air quality emissions stuff as well. So, yeah.
Regarding air quality at the airport, I'm just looking at that thinking, well, the airport's an enterprise, the airport has a budget. It would be really nice to be able to pull some of the costs of this from the airport budget, from the enterprise budget. And I wonder if that's something we've discussed you've discussed with staff, or so we should bring that back to staff, because it might be something that would fall within airport expenses, and to put it in a different budget category, which will take the pressure off my board, who are always getting nervous when they see new FTEs come forward.
Right. And the airport's one piece of what we want to think about is the larger area around the ABC.
Right. Yes.
And we have the highway that's going through there. So we have multiple sources. So the airport's a piece of it, but I'm certainly open to ideas about how we could help fund that to drive that forward if it's appropriate. So, yeah.
Great. Thank you. Yeah. And there may even be other funding entities involved in that case. Just a thought. Thank you.
Could I have a question?
Dr. Kurt.
Is there any ongoing plan to do monitoring in the AABC Burlingame area?
That's part of what we're discussing right now. I've been working with CJ Oliver at the city in Aspen Environmental Health Department, and then the airport. We've been working on the study for the airport piece, but one of the things that's come up is both of us have a desire to expand the criteria pollutants that we're studying at the airport into the ABC. But again, that's a funding question that we just haven't had a chance to get something more solid in place so that we can bring it back to the board to further discuss, but it's on our radar to do.
And
Thank you.
are there any updates or changes in the ongoing monitoring that's in the city of Dallas? Or is that separate from dealing with the county program? Such as on top of the yellow brick.
Those are, we have had some changes to the instruments or the units on top of the yellow brick. That's a EPA piece that gets passed down to our department through the state health department. We just made changes to the unit that's up top. And right now, ongoing, we're helping to maintain that, but that's a better unit that we should have better data from the yellow brick. But I don't have more at this point because that change has been recent enough. I haven't seen the newest set of data from that yet.
Thank you for the questions. Very timely topic. We've been getting letters from residents at the ABC North 40 just about the certain times, maybe during an inversion or whenever, or when all the APUs at the airport fire up the diesel generators to keep the planes going, get the planes going. It becomes pretty intolerable out there. And so I was going to try to pull up a letter from somebody asking, what we intend to do about that. Air pollution just wafting over. And it could be a combination of highway or the airport because there's so much traffic on the highway as well. But they definitely smell what they think is jet A fuel and things that are associated with the airport. And the only answer we have right now is with the airport changes, modernization that we're looking at, we would be electrifying all those devices on the ground at the airport. So we could eliminate a lot of that residual or, ambient diesel and jet fuel smoke. So that's
I'm
part of
also
it.
putting in a plug for epidemiology being its own separate heading because it's so important with things coming up like the bird flu and resurrection of, the different COVID strains that will probably occur with this winter season.
Separate heading in environmental health priorities or
in the EH priority, in other words, separate that out. So epidemiology has its own heading.
interesting.
It does, it's actually its own budget,
Mhm.
and department as a budget. But we have one person, in it. So for our purposes of presenting this, it is encompassed within environmental health. But I think that the importance of it is not to be understated.
Just trying to anticipate the winter season. As you know, we're going to get on with an op-ed in November about that.
What do you mean by its own heading? Because it seems like we have
So
it.
it's more visible to the public and how it, it interacts. It might have more than one person in that section, at least part-time in the winter.
Great. Public visibility is what I'm hearing. Yeah.
But that's a strong function of any public health department.
Sure.
So not related to the budget, but just related to.
How it's structured.
For further, we can discuss that.
Yeah.
Or maybe you can and come back to us. Okay. No, that's good. Oh my God, Liz. I know. I was having the same problem 5 minutes ago.
Thank you for the applause. Thank you for the applause.
Fireworks.
Okay, do you want me to talk about this slide now? Sorry, it's a
Yeah,
little
great.
hard.
Sorry for that aside.
No.
But yeah, that's what we were doing. Thanks for the reminder.
Okay, thank you. Okay, a couple of things that we have for revenue increases in environmental health. Our radon grant that we have been receiving annually from CDPHE went up an additional 5,000, so it's now 10,000. The next two, ELC 2.2 and immunization number 5 are COVID related. We weren't anticipating these, but these are funding streams left over from unspent COVID funds at the state level. Again, they have to be specifically spent with COVID or respiratory illness. ELC 2.2 is really around staff time, and then we have some educational funding in there. Immunization 5 is again around education and of the immunizations specific to COVID, and again, some communications funding in there as well. CDPHE immunization, that is a grant that we get funding we get every year from the State Health Department. This is typically passed through to CHS with our immunization contract that we have with them, but there was a slight increase there. And then the public health emergency preparedness, or FEP, We had a slight increase in that grant as well.
And those aren't thousands, those are actual numbers, right?
Those are actual numbers, yes. So very small, but increases, so, yeah. In terms of expenditures, we don't have anything new. The one that is pending out there would be if the air quality specialist position was approved by the BOCC, then we would have some additional expenditures around that position, salary, computers, the phones, things like that, that we would need to, for a new staff member.
I want to propose that they're based at the airport for the previous reasons.
As long as I can manage them. Any questions?
I don't see any.
Okay.
Let's keep going.
Okay. So this is a slide of the overall budget that's being proposed for 2025. That's in the green highlighted line. The top portion are revenues. So we can see that our revenues come in at about $2.1 million. Expenditures below, so salary, wages, professional services, etc. Totaled up, come in at just over $4.5 million. The next section are additional transfers that we get in from different sources. So the first transfer is a transfer in from the general fund. We also get a transfer from the Healthy Community Fund. So that is the Healthy Communities ballot tax. Healthy Community, the Healthy Community Fund is a tax that we will probably be needing to go out again for renewal next year. So that will be a big role of the Board of Health to help in getting that word out. That contributes nearly $900,000 to our budget every year. And then we will also get a transfer in from the Healthy Community Fund for those mental health specific RFP work. And then the other transfer is out for some of the a position that mental health RFP work funds within Human Services. So all told, when we look at the bottom line there of our total fund balance will be about 1.2 million. According to this budget, we will have, about the $313,000 deficit that will be coming out of that overall fund balance according to this budget. So happy to answer any questions as I can. And then this is what we would like to have the board be able to recommend to the BOCC.
Questions other than mine? So the Healthy Community Fund is a county fund that's it's what's the word? There's a mandate from, is it from a vote? It was a ballot measure to create this. It does come from the county revenue. So along with the general fund, so we're really at 2 million is what's coming from the county directly, correct, in revenue toward the public health department I just want to make sure I understand that. But Healthy Community Fund is designated for specific purposes.
Of which public health, I believe it's 22% we receive of the total fund that's collected.
Got it.
The senior center gets a big chunk of its budget from that, which is a health function for seniors.
The community, right, yeah.
And then the rest.
And we
of
support
that-
about 70 nonprofits, not arts and culture related, but all the other ones, many of the other ones. Yeah. Okay, great. Anything else on this one? let's keep going, I guess. Oh, we're at a decision point. You want to approve this, sending this to the,
So, yeah, we would just, we're looking for a recommendation, to, recommend the budget to the BOCC.
is there a recommendation that the BOCC do we want to wait and do an allocation, a special allocation for 313,000, or how does that work?
No, that would just come out of our, fund balance.
Out of fund balance. Okay, so we don't have to just add that to it.
Yeah, it's just a recommendation of this, and then I would say, for the board, if anyone had comments regarding, I think the air quality specialist position is probably the biggest budgetary impact that we have, that we would want to, but if there was any additional support or rationale from the board, we could also bring that forward to the BOCC for consideration.
And is that included in this budget?
That is the position, no, it's not included in this budget.
And what's the cost? Did you show us the cost for that?
No, it would be a full-time position.
Why is it not included here if we are anticipating it?
Because of how our budgeting works, the
Okay.
administration team from the county department goes through all of the position requests as an entire county.
Okay.
And then they initially make the decision to recommend to the Board of County Commissioners what they have included in the budget, what they have not included, and then what is pending. So those are the three different categories. The one thing that is included in this budget is the extension of that part-time, term limited mental health data analyst position through 2025 to correspond with the strategic planning, because there is funding for that. The air quality specialist is not included in here. We currently, Greg, to your point, we currently don't have revenue to support that. That was the recommendation by the administration, was to put it in the pending category, depending on what happens.
So be a separate request from this.
Exactly. So if, so right now, the Board of Health can speak in support of it, or saying, no, pending sounds fine. And then if it's pending, what would happen is if there's a need throughout the year where, we go forward with the airport and the studies, and we're needing this position because the workload increases dramatically, or if Tom retires, those would be places where we would come back to the BOCC to say, we're requesting that this pending position be considered midway through the year.
And do we have a cost for that program, the air quality program? So think about what the actual cost would be if we try to figure that out.
It'd be in excess of 100K because
Salary plus.
CSU graduates people in that category, community environmental health specialists. Colorado State.
I don't have the number. If it gets chosen to be put in the budget, then they go through the process of deciding what level it would be put in at. So I don't necessarily have it, but it would essentially be salary and
Salary,
computer
benefits,
phone
and
benefits.
basic office, right?
Do they
Okay.
need us like a
100.
formal
I think it'd be
recommendation
great
from
to
the Board
get-
of Health saying,
I mean,
"We
we're a
support this,"
community
or
where it's really
you would
needed.
go to the
People ask
county
for it.
commissioner and
Yeah.
say, "I'm
Yeah.
supported by-"
But we haven't-
I think that would be a good expenditure.
I don't think we've violated any air quality standards from the feds. And that's always comes up whenever this comes up with
It's
with
good
the
to be
airport.
prepared.
Well, the airport's like, hey, we're not breaking any rules. Do we need to? And everybody says, yeah, but we can smell the volatiles. The things you can smell might not necessarily be detrimental, but you still, it sure would be nice to know.
It
Uh,
would.
And as we electrify, hopefully that'll improve. But that's down the road. So.
But having some data, I think, is the important piece for our community, and one of the driving forces here for that ask is not
Yeah.
just the aspects of, yeah, we're not in violation, but if we have some monitoring program in place and we have the data to demonstrate that, that goes a long way.
Yeah, I certainly think that's a good idea too, because it does come up on a fairly regular basis. Thank you.
So at a minimum, just looking for a recommendation of this.
Do we need
budget.
a thumbs up or a vote?
So
Oh.
moved.
Okay, we've got a motion to approve.
Second.
Got a second, all in favor?
Aye.
Aye.
Aye. Okay, we're gonna move forward. I was wondering why you were sitting there looking at me, and then I realized there was a little blue flag.
The next is also Kurt will be presenting the smuggler super fund budget. So that is a separate fund in and of itself and has its own priorities and own budget. So take it away, Kurt.
All right, thanks, Jordana. So as Jordana said, the Superfund has its own budget. We have funding that comes from disposal fees at the landfill that typically that's a state level fund, but decades ago, the state had agreed to let Pitkin County keep those funds to pay for staff time and emergency response with, if there was any, with the Superfund site. So we have been accumulating that funding and then utilizing that to pay mostly that's Tom's staff time with his work at the Superfund site. We've had a couple of changes or potential for changes that we thought we wanted to bring forward to the Board of Health and the county commissioners, just because it impacts funding and potentially workload. So earlier this year, the EPA changed their lead in soil standard and lowered it. The major contaminant we're dealing with in smuggler is lead in the soils. So the question that has been asked is, how does this new standard impact existing facilities? Anything new has to be compliant with this new standard, but it's not clear yet as to whether or not existing facilities do. My understanding is the EPA is working case by case with the individual sites that are already either have done the work or in the process of doing the work to make a determination. I bring that up because if we had to go to the new standard, it's 200 parts per million lead or less. When the Superfund was first put in place, we were working on 1,000 part per million standard. So lowering that standard could mean things. We may have to redraw the smuggler maps, redo the blood studies. There's all sorts of questions if we have to go there that there'll be an immense amount of work that potentially is out there for us. We just don't know yet if that's going to happen. But it's an important piece to point out because we could have a lot more work coming if we have to be compliant with this new standard.
Thanks,
The
Kurt.
other, oh,
Yeah, go ahead.
good, okay. The other thing that's in conjunction then is in May, we were notified that the State Health Department, the Hazardous Substance Recovery Fund, or HSRF, that's a fee that, again, that gets charged at the landfill, that's what we've been using to fund this. They have taken this feedback from everyone in the state, not just Pitkin County. It is supposed to be temporary for a year, at which time then we're supposed to get it back. So as of right now, we're not collecting any fees. Fees are about $8,000 a year or so is about what we get out of the landfill. Kathy Hall, who's the landfill manager, has done this fantastic job of limiting the amount of trash that stays on site, and that's ultimately what funds this. And so as she's done that, our fees that we've been collecting have been going down less and less and less and less. But nevertheless, right now, we're not collecting anything. Again, my biggest concern here is, having done this for a few years, I've not seen CDPHE ever give a fee back once they've taken it. So I have some concern that this time next year, they may have not given that back to us. And at which point I think we'll look to engage the Board of Health and or the Board of County Commissioners to talk with CDPHE about that, because that is an important funding source for us. So right now we have savings in that in the smuggler budget that we're able to continue to fund Tom's time, my time. And if you go to the next slide, you can see where Connie has gone ahead and run the budget out for several years. The end of the year estimate right now for the Smuggler Super Fund was going to be 348,000 and change. As we get into 2029, if we assume that we have no income, that will then drop down to about $25,000. Sorry about that. My phone thinks I'm talking to it. So obviously that's an important piece that as we learn more from CDPHE, and if they're going to give that back, then that will alleviate some of these concerns. I think the other piece is that there are opportunities if we do get this fund back to then look at the amount that we're charging. Right now it's 4 cents per ton that goes into the landfill and stays there. We can charge more than that. We haven't, but as we think about balancing this budget in the future, and if we get this feedback, that's something else that we will bring back to the board to talk about.
That's
So
4 cents per ton of garbage or 4 cents per ton of dirt or?
garbage. So this is a fee that's on garbage, and it's garbage that stays in the landfill. So if it goes somewhere else, then that fee isn't collected. This is just what stays in our landfill is what's accounted for.
So it looks to me like if this funding from the state goes away, it wasn't enough to cover it, apparently, cover the cost of this program anyway. If it goes away, to me, it starts feeling like an unfunded mandate from the state. And when we get those, we really hate it because it sucks money from us. And honestly, I for years have wondered if there was any value to this. And I don't believe there's a single case of any sort of bioavailability of lead from smuggler hurting anyone. Has there ever been an emergency response?
Because the reason for this soil mandate years ago as a Superfund was to protect young children who are more susceptible to having the lead cross the blood-brain barrier when they're in infant stage, particularly preschool. The way that we could see whether this is working or not is simply go to the pediatricians in this town and community health services and say, will you provide us with the blood leads done on all preschool children? If all of them are 3.5 or below, why do you really need the program?
Well, that's
working.
That's the question.
And I don't think we have that data. That's not a requirement, except for WIC clients. And I don't know that we have many WIC clients in Pitkin County. And then on top of that being in Smuggler. So, or not WIC.
The regulations, were made in the
Hold on a sec, one at a time.
1970s when I was.
Right. And when this first
So I
came
know
along,
the whole history of it.
so we've got to pay for this in perpetuity. That's our deal with Superfund.
But I think it sounds
Right.
like that the standard's been lower, so it's more restrictive now.
Which could actually
Sounds
put,
to me like this program needs to continue, and I don't think that that's a reliable way to kind of say if we need to keep funding it or not. I don't think that there's reliable blood levels on every child here to be able to say, well, we don't have a problem anymore.
That's my understanding. We don't have data to demonstrate that. The blood.
we don't have a problem. They can't. Prove,
Yeah. I think there's an aspect of we'll have to get into that, especially if we end up with having to redo the smuggler maps because we have to go down to the new standard. I think that's a question, Greg, that we have to think about. Right now, we have an agreement with the EPA from our lawsuit with the EPA that we're running this into perpetuity. So I think all of those things come into question, but until we know what the EPA wants to do with the new standard, I don't know that we can answer that.
Would they
Right.
ever go to like a tax to cover this?
I don't know if we can. That's
Our ability to fund the Smuggler Super Fund program is that jumping fee that we have
Right.
locally.
Right.
Issue is, that's been ours. We've been, I don't know how many years we've been collecting that.
but they would take that.
The issue is the state has the power to co-opt that, and they've taken that for this year. I think Kurt's point is if it continues to be more than a 1 year issue, we do not have any other way to continue to fund this work. Greg, to your point, is this an unfunded responsibility into perpetuity? Yes. And we've explored, the board had asked us to explore earlier this year whether there was any way to work with the EPA to get to a different level of,
Mhm.
you know, remediation in so much as that we can, you know, provide all of the data that we want to say, you know, this is not a health concern any longer. Regardless of all of that, the response we got from the EPA was that the only circumstances where they were able to, are you gonna remember the terms for
Yes,
when a site,
the site has to have, it's no risk to humans. So whatever was spilled or whatever contaminant was there causing the health concern has to have been completely removed. Jordan, I'm trying to remember the term now too. But essentially, because this is a naturally occurring contaminant, we're not going to ever get to that point where we can then be free and
You're going to
yeah.
continue this forever, but
Yeah.
I'd be curious whether there are any kids in that neighborhood who have an increased blood lead.
Agreed. And I think there's the
Yes.
state health department may have some funding
Working.
that we can apply for, but it's still very much in an infancy stage. But that is one of the thoughts we have, Dr. Kurt, is seeing if we can get the state health department to help us with going in and doing some blood lead level testing, especially given the with what we think may be happening at the EPA level. If we can get some data to arm ourselves to talk about this, then we will.
Right. Thank
But
you.
this is all kind of working in the future.
It's
These
working
things have
here.
just come to fruit in the last month or so.
There's another aspect too. Yeah.
I think the other thing that Tom Dunlop talks a lot about is that there was a study conducted back when there was the discussion of whether
Yes.
to designate Smuggler as a Superfund site. Even then, there was no elevated blood lead
Right.
risk. There was one kid, but it was
He was playing with his motorcycle.
Kid who was riding
Exactly.
over the
Lead
smuggler
power,
line.
lead gas, right.
so.
Right.
So
He's
I
down
think
on the police department.
we could,
Probably
it
somebody
would
you know.
be good to look into to see if it's working, but it was never at a point where
Right.
it wasn't working.
Well, you know, it'd be interesting to see, this is going to just become infinitely expensive to us over time, and it's growing. I'd love to be able to retire it when Tom retires. That would be a good cap to his career, is like, let's just stop this. The other side of this is that the landfill can no longer take fill dirt from Smuggler, any of the excavations there. So the cost of excavating your basement in Smuggler has gone up 3 or 4 times. I think it used to cost maybe a few $1,000s, and now it's into like $30,000 or $40,000 to,
Wow.
because they can't use the dirt to cap the landfill any longer. They have to dispose of it like it's toxic waste. And you just think that's one aspect that just, this is crazy. Okay. If it doesn't seem to be a problem, and of course we haven't determined if it's a problem or not at this new level, but the other can of worms that's opened up, which I guess I'll talk about it, is that if we're down to 200 parts per million now is the new standard, it's possible that the entire Midland Railway corridor, the Holden Meralt property, all that
Yeah.
would qualify as a Superfund site. And so we wouldn't be able to excavate.
Would probably qualify.
Yeah, we wouldn't be able to excavate anything there. So
Who's doing sample, like,
Well,
to check levels? Or is that?
is
being
that,
done?
do we even, I guess that's what Tom has been doing, right? He takes a sample once a year or something.
we don't take samples, but that's because we have sampled that site enough that we're confident with what the results were. Obviously, we would have to go back and resample it with the new standard. But there are standards outside of the Smuggler site too, that the state health department enforces already. So when you were doing construction on another site, the Country Day School is a great example where they have lead in the soil there. They had to meet requirements, but even though they're not a Superfund site, we have lead in the soil, and there's still a controlling standard regardless of that. So Midland, if those things were all excavated, we would still be making people test for it and then disposing of it in an appropriate manner, regardless of being on the Superfund site.
Got it.
I think this is a great question for county attorney candidates.
I was thinking that's a great question. It's like, yeah, I'm feeling really litigious right now.
That's not, yeah, that would be the place that it would go, because we don't have any other.
Right.
ability.
When we get a little bit more attorney bandwidth, maybe this will be on my list.
See how other Superfund sites across the states have dealt with this like
Right.
endpoint.
Well, this could just completely stop all of our growth control problems. Okay, sorry, Kurt, for that digression. I know, I knew you'd perk up when I said that.
And Tom and I may know more. We had a request from our EPA contact to meet. Tom's obviously out of the office right now, but we have a meeting set with her at the end of October. So I don't know if this is going to be very specific to this, but that's my guess. So I'll know. I should know more here shortly about how the EPA is going to approach our site, or at least some more guidance, and then we can go from there.
Got it. Anybody have any other questions about this? It's a giant can of worms and enigma wrapped up in a burrito.
So we do just need a
Do-
recommendation on the budget.
Right. You can all vote yes. I'll vote no, just out of protest, but I need a motion to approve this.
I'll make a motion to approve the budget.
I'll go along with it under protest. Any other conversation? All in favor?
Aye.
Aye.
Anyone against? Aye. Okay. Thank you. I might get thrown off. I might not get to be the Board of Health Chair anymore after this. Thrown off the board. Okay, thanks, Kurt.
Thank you.
What's next?
Respiratory disease update, and Dr. Levin is going to walk us through the first couple of slides.
I am, because Carly is not here today, so.
Is she out with a cold by any chance? I'm just wondering.
She has a respiratory illness. Unidentified.
Had to
No,
ask.
she did, she's not. So her first slide here, and Carly made these slides, and we're grateful for her to do that. So the season officially began October 1st. The CDC, these are some good resources that she wanted to put up here. Publishing their flu view, it's called. You can look at that at the CDC, and then CDPHE at the state level is on October 16th is starting to update their viral respiratory season dashboard. And I think they're trying to improve it and make it more comprehensive, and that will be starting shortly. So 2 good resources of where to look for data in the upcoming season. The graph on the right is really challenging my eyes. But so this is ILI, still tracking influenza-like illness, which is what we tracked previous to COVID, and still tracking that. Oh, thanks. I tried to pull it up and couldn't. And so these are obviously previous seasons, just to look at what the shape of the curves were in previous season. And the red, the red one, which with the little circles on it, is last season, the 23-24. So we saw a peak right in the beginning of January, the last day of December, and then it went down, and then you see it kind of coursed up, and then there was a slowdown. So it was the longest season that was kind of sustained. And previous to that was the orange one, is the 22-23 season, which you remember with RSV, there was that really huge spike, more in the beginning of December. And so that's what kind of coursed that curve to the left, and a very early spike, and then it just plummeted after that, which was good. So every year is different. We don't know exactly what it's going to be like this year. We'll talk, I think it's the next slide, looks at the efficacy of vaccines. But again, the important data points that we're looking at are hospitalizations, ER visits, and deaths. So we stopped looking at positives and, in terms of testing, there's all the kind of bedside testing, the POC testing, and none of that is really being compiled in data anymore. So it's hospitalizations, ER visits, and deaths. And I just looked at hospitalizations for COVID at the state level. And it seems like there was a little bit of a peak, and we're on the downswing, but we're also kind of in the in-between season. So it'll start upswinging again soon.
If we were to put.
We're in a good place right now.
Yeah, if we put visitor population or county population data on top of that, it would be interesting, I think, because you see the spike at holiday season down and then up again, with the red data up again in, say, March, comes up again when it's busy again, and then it kind of tapers off as spring comes. And I just wonder if our tourist chart for population in the valley chart would mirror that somewhere and inform this in some way.
Yes, but previous seasons didn't do that. Last year was kind of unique in that
Kind
there
of
was
all
like,
that spike.
yeah,
though.
and a lot of times there is, I mean, she only went back, just because these get a little confusing if you have 10 years in there. So she only went back to the 2021 season, which we know was pretty flatlined, the green one at the bottom. But if you look back further than that, a lot of times there was an influenza B spike. This was before COVID. And so the flu vaccine addresses that every year and hopes to help with that kind of second surge of B. And I don't know if B was really responsible, because this is all of ILI. This is every respiratory illness on this graph. So, and then she wanted to also highlight that wastewater continues to be a key population level metric, and it is actually now expanding at the Aspen site to include RSV and flu, which I thought was amazing. She explained that there were 56 sites across Colorado, and they pared them down to what the most important ones were to 22, and they retained the Aspen site, thank goodness, just because they wanted to actually keep the main tourist sites in Colorado. But they did pare those down to 22 sites across Colorado to represent, and there's biweekly samples that are sent to CDPHE. And of course, all of this is the wastewater data obviously lags a little bit, but I think it's great, and we'll see what it shows for RSV and flu, which is pretty exciting that wastewater continues to expand its role in epidemiology.
Remember when that first popped up during COVID, and
Right.
it was such a new idea
You're
that
like, what?
what's this about? Now it's
That's a thing.
right. Yeah.
Yeah.
I remember that.
So
Yeah.
a perk from COVID.
Yeah. Thank you.
Any questions on
Fascinating.
the graph or the previous slide, I guess? No? Okay. So respiratory illness season officially began October here we go. Oh,
Next slide.
Back.
you can see how we're on these slides. Okay, so she wanted to do another slide on best practice reminders. We all know these. This is something that the public, we all need to keep telling each other and reminding each other and have public messaging on. And getting vaccinated is the single most important thing that you can do in terms of prevention. So looking at the flu vaccine, which we have some data from the Southern Hemisphere, that it looks like it's 35% effective this year. It's a trivalent vaccine, 2 A's and 1 B. And 35 looks very low. I know when the public and the board started looking at these numbers in COVID, we saw the mRNA vaccines were in the 80s and the 90s. So we look at this and say, well, is this worth anything? And the answer is yes. The flu vaccine typically kind of hovers around this. She said that this is kind of in the middle. Last year, it was about 50%, but it was a high year for the flu vaccine. So yes, the flu vaccine is effective and everybody should be getting it. And this is against severe illness, which is what, we really want to prevent. Nirsevimab, which is the RSV vaccine, is shown to be 76% effective at preventing severe illness in infants last year. So this vaccine is amazing, actually. And again, it's for newborns that have not been through a season and a winter season. So if babies are being born now, those will be vaccinated. It's for pregnant women who are 32 to 36 weeks. And so it will transmit it will transmit some efficacy to the baby who's born in the season. And then for over the age of 75 and people over the age of 60 who have at risk. And so it's proven to be really effective. And again, for infants, which are really at the highest risk, this virus can cause apnea where they just stop breathing and die. And so if you've ever seen an infant in the ICU who has RSV, it's really critical. And so this vaccine is so far, I think, amazing. 76 is great. And then last year's updated COVID, I think she meant to put COVID vaccine in here, had efficacy of 57% against symptomatic infection and 69% at preventing severe illness, which again is great.
Can I ask about when to get vaccinated?
Yeah.
Is it, or do you wait as long as you can and into the early winter, or do you start now? What was the best?
Start now. You start now. And I think you can get them both at the same time, one in each arm. There's no problem doing that, and you start now.
If you've recently had COVID,
And yes, so the recommendation is 3 months to wait if you've had COVID to wait to get the vaccine. But it's still recommended to get it if you've had it and you wait the 3 months.
Got
And last year they had the vaccine almost through March, I think, or April. So, if you have COVID now, you can wait 3 months and get it in 3 months from now.
Got it. And it's available at pharmacies, and is Community Health doing any vaccination?
Community Health Services has some vaccines, absolutely, and they'll start doing flu clinics. They have some COVID vaccines as well, there's the Bridge Access Federal Program, which provided free COVID vaccines, is no longer operating. And so there's, the state is helping out, is now stepping in because the federal government program has stopped providing free vaccines for the uninsured and underinsured, and most insurances cover this vaccination, and you can get it at City Market Pharmacy and at your physician's offices, and use your insurance to cover it. So Community Health Services those are trying to reserve those for the uninsured and underinsured. They got, I think, a total of 20 from the state, and she's trying to work with the state to see if they can get a bus to come up here as well. So stand by for that potential.
And is that for all three or just the COVID vaccine?
I don't know. I think
Don't
we'll
know.
see.
We'll
I
see.
think we have a lot of flu. Community Health Services is going to start doing flu clinics from now until early November. And so they'll be doing remote offsite flu clinics. But yes, it's highly encouraged to get both vaccines starting now.
the challenge is the paying for the COVID vaccine if you are uninsured.
Yes.
As Dr. Levin said, if you're insured, you can get it at a pharmacy, your insurance will cover it. You can get, a lot of doctor's offices have it. But we are hoping to get the state vaccine bus up here.
Right.
They'll do a number of vaccines, but their target is for those folks who do not have insurance
For COVID and flu.
for COVID and
Yeah.
flu.
Okay,
Great.
great. And
Thank
hopefully
you.
we can get it here. And it's just so interesting, the pandemic, so many resources came out, and it was so, we did big clinics, and now we're kind of really easing into what normal annual COVID vaccines are going to look like in the future, because it's no longer boosters. That is no longer what it is. It's just an annual vaccine. So
Sorry, I
okay.
used up all of our time on that topic.
That's okay. I can go quickly through the others. Stay home when you're ill. We all know that. You can get some free COVID tests mailed to you, and it does work. I've done it myself. And take care of yourself at home. Don't expose others. Wear a mask. Where appropriate. If you're ill and you have to be in public, wear a mask. If you're ill and you don't have to be in public, don't go. And wash your hands frequently. And this is the important messaging.
Thank you.
Thanks for.
Is that it?
Oh, yeah, of course.
One
I think
more
that's it.
quick
Oh.
slide to talk about the importance of respiratory illness and the communication campaign that we are putting out. We have a total of $12,000 that we're working with. Half of that is sponsoring public health to be on the Aspen 82 morning show once a week for the entire winter season. And then the other $6,000 will go towards a mix of print, digital, radio, social media, and digital radio ads. So I think it's like either Spotify or Pandora that you'll hear these ads on. And the focus for the beginning of the season, October through December, is really around that push to get vaccinated. January through April, we'll push more of those healthy best practices. And so last year, we had a very similar campaign that we ran, and we saw some great success and contact points for Spanish speakers with those digital radio ads and print ads in Spanish in the Sol de Valle. The Spanish speaking focus is really important to this campaign because we know from national data that Latinx individuals suffered worse health outcomes due to respiratory illness than the general populations. So to address these health disparities, we're taking some particular attention and giving that towards assuring that we're reaching our Spanish speaking members of our population.
Great. And will there be outreach to the local papers, English language speakers, public radio listeners? Was that part of it as well?
Yes.
Okay, great. All right, thank you. Oh, the fun part.
So, who knows if it's required or optional to do an annual Board of Health training?
Is this a quiz?
No.
It's required. So, when I talked with Greg, and he thought that the best way to just make sure that we all can meet this requirement to the best of our abilities is just to take some time out of our board meetings and to review, and then also that we might be able to add some value to the trainings by also incorporating some discussion and conversation. So I have pulled out some of the highlights that I think are most relevant to how our board functions. And I think we've got about 45 minutes.
35.
35 now to be able to just spend this time.
So we're going to try and do it now. Okay,
Yeah.
I was thinking you were going to book it for later. We have to get this done.
We're just
Yeah.
gonna do it.
And it's a
Okay.
state requirement, right?
And you're going to make it fun.
It's gonna be so fun.
It's gonna be awesome.
So
So this is instead of us doing it on our own.
that's fine, instead of everybody doing it on their own.
Okay.
And the one requirement is after we do this today, you should have an email waiting in your inbox for you to fill out an evaluation, a Google form. It basically says, how useful did you find this training? Is it going to help you be a better Board of Health member? I would say the most important part of that evaluation is the comments section. If you have thoughts as to content, material, what you liked, what you didn't like, what you would like to see in the future, the folks who do this training at OPHP at the state are incredibly responsive and would love to hear your feedback. And I can promise that they take that into account when developing the next year's training. So with that, we're going to start off by just talking about the 6 functions of public health governance. So NALBO is the National Association of Local Boards of Health. They're another, professional association if you wanted to check them out. They outline these 6 different functions, and Nancy, or if I can share my screen.
Yeah, whenever
Larissa.
you're ready. Are you
I'm
ready?
ready to share my screen to have us walk through these 6 different functions, learn a little bit about them. And
Should be able to.
great. See if we learn anything new.
The first of the 6 functions is legal authority, which we have already looked at in this module. A Board of Health's responsibilities with respect to the law are a very important aspect in the role as a governing body, and it may exercise legal authority to ensure provision of public health services when local laws and state statutes allow. As a legal authority, boards of health and their members need to understand the rules, responsibilities, obligations, and functions of the governing body, health officer, and agency staff. A Board of Health must make sure that it acts ethically and within the law. Your Board of Health may need to contact legal counsel if necessary. As an example, Think back to what you learned about the New York City Board of Health in earlier modules. They partnered with experts in public health law, among many others. The Board of Health involved legal staff to ensure the proposed health code amendment would be effective and able to withstand legal challenges.
That's it for legal authority. Does anyone have any questions about this function or thoughts on where we have engaged with this concept of legal authority as a Board of Health?
Any thoughts? Yeah, when have we used this in the recent past?
I'm gonna go with COVID.
We have a winner.
When we closed the indoor restaurants for 2 weeks.
So this Board of Health has the legal authority to act if there is risk of disease to the public. So that continues with us to this day. If there was someone who needed to be quarantined or isolated, that's something that the director can take, or we can have an emergency meeting come to the board.
Which just as a side note, came up in conversation with Carly about Marburg virus in Africa. So, you know, remote possibility, but if any quarantine needed to happen here.
Right,
Great.
good example.
The next function is resource stewardship. This means ensuring the financial, human, and other resources needed to perform the essential services of public health are available. Resource stewardship also consists of creating budgets, discussing long-range financial planning, developing agreements to share resources with neighboring governing entities, and advocating for more funding for agencies.
Any examples here come to mind that we've already talked about today?
Creating budgets. We approved your budget. Approving budget.
Suing the EPA over lead poisoning.
And I think that advocating for funding, just want to keep putting it out there that Healthy Community Fund is so important to the budget of the Public Health Department. And as Board of Health members, you all are able to speak freely in the community about things that are on the ballots. And so that will also be a really important role that the board can play when that comes up. Anything else folks are willing to contribute here?
That's great. Go ahead.
Next is oversight, in which a Board of Health takes the responsibility for guiding the public health agency to achieve population health goals and outcomes. Oversight may also include acting as a liaison between agencies and elected officials, designing, hiring, and evaluating the health officer role to meet public health service administration needs, and actively participating in governing entity activities.
Any activities here that you can relate to?
If you all call me and ask me to advocate for this in our budget meetings, I would do it, right? Haven't done that yet. Nobody's done that yet.
So we oversee the health officer role. The health officer, I think is more often, it has a different number of names. That this is a national publication, but it's really referencing the public health director role, which in different counties is called the health officer, or there's different names for it. But if y'all remember, when it was time to hire a new director, that was the responsibility of the Board of Health. And making sure that the credentials and requirements of what the state needs in a public health director were met.
The fourth of the 6 functions is continuous improvement. In this function, we are looking at improving community health and the agency's ability to meet responsibilities. To ensure continuous improvement, the Board of Health must regularly evaluate, monitor, and, if necessary, set new measurable outcomes for population health and agency quality improvement. Continuous improvement may also include the need to evaluate effectiveness and provide opportunities for professional development.
Anything here that relates to your experience?
Well, we're doing some professional development right now.
Right now. Thank you. Thank you, Susan. I was grasping for something. That was perfect.
I haven't mentioned co-train so far, you know, the Colorado training, which has that function.
Yeah, and this training is,
Part
so
of it.
part, I'm on co-train right now. Sharing this with you, y'all.
So if we send you off to get a training for something or one of your staff, that counts as well, right? I'm sure that's happened in the last every year.
Happens every month, I would say.
Got it. Great.
Well, and wouldn't advertising in the papers about vaccines being available be part of this as well? Outreach?
Outreach, yeah. I mean, and then are we measuring our outreach and effective outcomes? And right, when we presented to you today, we said, why is it important? You know, we're looking to improve community health. Why is it important to outreach to our Spanish speaking population specifically, right? Because we know they suffer worse health outcomes. So all of that is in the spirit of continuous improvement, looking at how we did things last year. What did we learn? How can we do things a little bit better?
And collecting data on psychedelics could fall under
Mhm.
this as well.
Exactly.
Does the public health improvement plan every 5 years come under this? Too? Right.
That as well.
Okay.
The next function is partner engagement. This includes creating, building, and reinforcing community partnerships. Partner engagement is done by educating, engaging, and collaborating with all entities involved in promoting and protecting the community's health. To do this, boards of health should participate in open dialogue with members of the community regarding public health issues. Partner engagement means serving as a link between different agencies, the community, and other organizations.
Right, that goes right to your question. What community partners and why?
Mhm. I think we should partner with the donut truck. In the
Yeah.
future.
I know. It comes by
See
the
that
police
neighbor
department.
did that.
Public health could do, you know, healthy donuts. We were just talking about that. You could, you know, the dearth of donuts here, but if they had donuts with Ozempic sprinkles on them, they'd cancel themselves out.
There is a good little mini donut truck at X Games every year.
Yeah. See, now you're advocating for X Games. I see. Okay.
No, for the donuts.
Ugh.
You ever seen a blood draw after you've eaten a donut? You see the triglycerides in there.
There could be a competition for that. Okay, sorry, we're getting a little bit, hey, try and stay in track.
The last of the 6 functions is policy development. This involves creating and contributing to policies that protect, promote, and improve public health using the best available research and evidence. Boards of health also need to make sure that policies are consistent with local, state, and federal laws and rules. Regularly updating vision, mission, goals, and measurable outcomes fall into this function.
So this board's been involved in some policy work,
The tobacco.
tobacco work.
Yep. Raising the age from 18 to 21.
Gun violence.
Yeah.
Right? Trigger locks.
That wasn't a policy though.
Oh,
That was a very strong recommendation.
Right.
You should have these on all your guns so that people don't get killed.
Donut.
But it's
truck
not
advocate.
a,
great policy.
I think it's is it a state
It is
policy
law.
that every new gun that's sold has one on it, but old guns don't have to sit with them on it. Like you don't have to have it in your house with it on, I don't think. Or do you have to for under Colorado law? I'd have to review
We
it,
can
yeah.
check, I believe it's, if minors have access
Yeah.
to, you know, the home, then the gun lock. will-
But we have not created any local policies that
We have a
are maybe
concept of a
stronger than state policies, which is what we did with tobacco.
Hmm.
And, you know, if that's something that we want to work on, it'd be great.
And I think
Um,
the other thing about policy is, public health helps provide that health lens, health and equity lens, I would say, even for a lot of internal county policies. Or, trying to get that public health lens at the table. I think in a lot of the introductory meetings I have with board members, especially who are on other boards, it's that request to try to wear that health hat, that equity hat. When you're talking, about transportation and RAFTA, you're talking about new housing developments and snowmass. Right, when we're talking about the entrance to Aspen and how much traffic and pollution and what's the air quality implications of that? So, I think that it's the policy development is, as we think back to the beginning of the budget presentation, if we can affect those socioeconomic, social determinants of health, policy is one of our best ways to do that. And it's not always at the Board of Health table that we have the biggest levers to affect those.
Yeah.
Well, I
Excuse me,
think
the other one is
especially being in one of the highest regions with the highest rate of suicide, which is primarily via guns. I have two long-term acquaintances and long-term community members have committed suicide in the last 2 months here. So it's an ongoing issue. And I would like to see us create a better policy to address this somehow.
Well, with the tobacco tax that went to a vote, and I mean, there's always that possibility of putting something forth, right, to the community and having a new policy created locally, not on a state basis, but if you want to try to really put something forth on a local level.
I'll work with Tori on that because I know this is a huge area of interest to him
I
as well.
mean, yeah, it would be groundbreaking, of course, but what happened with the tobacco tax is that it created a domino effect, and then it went down valley and ultimately went to the state and became a state policy, and that's how things change. That's how you create change locally.
No
So-
smoking in restaurants.
Yeah, so
Same thing.
why not try to put that into new realms and address things that we want to locally? It's one of the most powerful ways.
The other piece of policy is also, you can have the development, but you can also have the enforcement and
Right.
we have some state level policies that help to support what's the law called, where if you are concerned about someone
Red
going-
flag.
The red flag law.
red flag law, going through, a mental health, a challenging time with mental health or there's concerns. There are ways that if you work with law enforcement, weapons can be stored safely to them until that concern has passed. But how many people know about that and how many people have used that here locally?
Right.
And how many times could there have been the option if that policy that was more well known? So I think there's also that opportunity to understand what's on the books, like also these requirements about like if not allowing children to have that your weapons have to be locked up if there's minors in your home. I think that's on the books, but not a lot of people know about it. So I do think that space of education around some of these existing policies is also a huge area of opportunity.
That's why I think it's so great. You started this off in June and it obviously takes a lot to educate, but a local policy, if it were, that balancing it with being able to police it and enforce it, right? Always. But when I pushed through the tobacco, the big concern was how are we going to enforce this? And local police, didn't feel like it was their job. This is more of a state level thing. So there's a lot of conversation around that. But eventually pushing it through, I think, you look at the risks versus the downsides. You don't want to pass something where you can't enforce it all, but do you want to pass something that actually, if you make it a law locally, policy, you're going to educate a huge number of people. And maybe you don't have a huge enforcement, but you have some. So that education piece alone is really powerful, but you have to, really obviously weigh it all into what's the best way of educating people. Is it through passing a policy that is not very enforceable, or is it through more education
Education.
locally? Anyway, I see it as a very powerful form of education, but you always have to balance it with the ability to enforce it.
Mhm.
So do you pass a law locally in the city of Aspen saying any gun in a house needs to be locked with a trigger lock and a, what is it, a case lock? What's the big one called? A locker, gun safe,
Yeah.
you know, whether or not there's minors in the bill, you know, or whether or not there's at-risk individuals who are unstable at the time or might be unstable at some point. Do we just say, hey, we're going to be the first city to do that? Or the first,
That'd be so cool.
that would be so
And
cool.
I think we have.
Right?
the
I mean-
Educated law minds around here that we could craft something that
Could the
works.
police go into could you walk into someone's house and say, hey, I'm just checking to make sure you're following the law?
That might be a step too far, but I
No,
think
you
if there
can't do
was
that,
a
Knock on the
law
door.
being broken,
Right?
or say the other, yeah. that
Can't
is
do
the
that,
other
but
night,
like,
Centennial.
You know,
Right.
maybe the education piece might change and save some lives. And is that good enough? Maybe. It's like,
Might
that's the
be.
conversation, right? So yeah, it's a great idea. From a great thought and discussion point.
You know, Kim, part of our, in the offices, I think with physicians and nurse practitioners and PAs, you know, in our office, one of the questions is, are there any guns in your house? And that's a good discussion point where you can reach people and say, you know, you have children, is it locked? And just to bring awareness to people. And, you know, that is part of the questions that we have in our office right now. And it's a great way to connect with people. And it's kind of a fun thing, you know, when they say, wow, you ask a lot of questions, you know, but it's really educationally rewarding, you know, to have.
It's really
that.
good to hear because that's definitely one of the tools and
Yeah.
one of the more powerful tools is right
Yeah.
in the physician office and having the conversation.
Yeah.
And the more you do that, the easier it is to be able to talk about it openly and make sure that people are safe, you know, but
Yeah.
I really appreciate you bringing that up.
Yeah.
And I could send, you know, that might be something that I can do in terms of kind of, having physicians do more of that in their
Yeah.
offices, you know.
You know, do you ever
Yeah,
have
thank you.
pushback on that? Do people ever say, well, I don't want to answer whether I have guns or not?
They're pretty
they?
open about it, you know, they're pretty, you know, because they'll either say, oh, well, my husband has them, he hunts with them, or yes, we do have them, and the next question is, you know, are they locked up or used,
Right.
you know, that kind of thing. I haven't seen any resistance to answering that question. So it's
I
kind
think
of.
if you asked that question in Montana, you'd get a different response because they're afraid that people are going to take their guns. Here, we're a little, as they more educated. We're not as concerned with government taking their guns.
Right.
But even if they don't answer that question, you can still talk about the importance of having them locked regardless. Yeah,
Yeah, it's great.
well done. Okay, well, there's our example.
Yeah.
That's a great example. I've got, so those are the 6 areas. We'll go through this one next section. And that's all I've got planned for you today. So just.
Great. We are doing great. I'm trained.
Proving.
So Board of Health structure in Colorado. There are 2 types of Board of Health structures in Colorado. An appointed Board of Health and then county commissioners serving as the Board of Health. We are the former, an appointed Board of Health, and I think that our Board of Health is one of the shining examples of boards of health, especially for smaller counties. This is the breakdown throughout the state. You see those in blue have the appointed boards of health, where everything in orange is county commissioners serving as the Board of Health.
This is such an interesting map. I've never seen this. So it's a little less than half or around half, maybe.
County commissioners can only serve as the Board of Health if the population is under 100,000.
Okay. In the county.
So you'll see all the metro areas require
They
an
have to,
appointed
yeah.
board.
Okay.
You can learn a little bit more about it. I think what I wanted to show everyone here is to play just an example of Larimer, because they are also an appointed Board of Health, and then to see if that inspires any discussion about our Board of Health structure and the benefits of it.
That's Fort Collins, right?
Yes.
Thank you.
Hi, I'm Dr. Bernard Birnbaum. I've been on the Board of Health for Larimer County now for 7 years. I'm the Associate Residency Director at Fort Collins Family Medicine Residency Program through UC Health and an Assistant Clinical Professor at CU School of Medicine.
Hello, I'm Tom Gonzalez. I serve as the Public Health Director for Larimer County, and I've been in this role for almost 5 years now.
There's a myriad of tasks that we deal with. So public health organizations have fiduciary or business responsibilities that we have to attend to. We look at public health county policy. We assist the director in making of the strategic plan. So that could be emergencies like COVID-19, that could be the community health improvement plan, that could be discussions around suicide prevention, which came up at the last board meeting. So those are the kind of things that we engage ourselves in. We are a appointed board, appointed by the county commissioners. That means that while we are appointed by people who are elected politically, we are not elected politically ourselves. That's incredibly important to allow us to step back and make decisions in the interest of the public that are not subject to our being voted on, which I think is very, very important when you're dealing with matters that may not be popular. The reality of it is that decisions that we make may influence what people have to do. And while we do have to answer to the county commissioners, we're not answering to the public at large. And I think that that's important when making hard decisions. We have a 5-member board, which is enough that it gives an opportunity for some dissent. And our decisions are not always unanimous. But we have a process that gets us there in a very peaceful way that I feel allows each member to say their piece, to be thoughtful, and to feel like they've been heard.
And I would also add, with the structure of our board here in Larimer County, the 5-member board, they come from a variety of backgrounds. One, a business owner, former legislator. We do have a couple physicians practicing, a retired military physician. We also have someone that's worked in community organization and community health improvement plans, as well as someone from the state. So we get quite a different variety of backgrounds that really helps influence the conversation and promote the conversation when we're having those decisions and what our best outcome processes we want it to be.
So I think it's absolutely essential that a board member be willing to understand what is public health. What are the 10 essential features of public health? What is Public Health 3.0? What are these acronyms that we need to understand? And be willing to study that, and to be willing to step back from the individual and look at the community. Those are sort of the prerequisites, and I feel like we've done that. I also feel like we've done a decent job of geographic representation. This is a large county physically, and we represent a number of different communities, and I think that's important and something that we could always be better on. Yeah, typical meetings are actually pretty well structured. So prior to meetings, the board gets a packet of information, and it's really essential that we study and go through that packet so that we're familiar with the information. There's a set agenda that includes fiduciary responsibilities, major things that have to be accomplished. At the beginning of every board meeting is an opportunity for public comment, and I think that that's an essential component of every public meeting. Following that, our discussion of the items that are on the agenda, and then finally discussion of a director's report, where the director is able to report what is the department working on over the last month. Since we meet monthly, it's a nice cadence to be able to actually have a pretty good sense of what's happening in the department, and provide feedback as needed.
Excellent, Bernie. I agree. The informed part is certainly the responsibility of the public health director to make sure the board is informed, not just at the monthly meetings, but throughout whatever the situation is, if it was a pandemic or our process with the community health improvement plan, and then always provide options. So the board has options that they can take in, deliberate, and make probably the best, outcome that we're looking for.
Advice that I'd give to a new board member includes a couple of things. Number one is study a little bit about what public health is. If you were not trained in public health, do not assume that you know what it is. I think it's important to actually spend some time learning, digesting it, asking questions. I think when a new board member starts, it's important not to come in with a specific agenda. I think it's important to come in and learn. And as you learn, then you can develop your set of opinions. But the reality of it is that public health is a field, both academically and in practice, that takes time to understand. I've been working now in the public health space for 15 or 16 years, and I feel like I know this much. And I think being willing to listen and study rather than to push an agenda is an essential part of being a good steward of public health.
There's challenges, but if you do that right and you bring the right people to the table and you hear all voices, the opportunities are endless, and that's where you can really improve public health.
All right. Did any of that resonate? Any of those comments with the Board of Health member resonate?
I did notice they were going to be looking at their septic system regulations at that meeting.
Oh, that was on the wall or something.
Precisely.
I'm curious about the frequency of meetings and large counties like that, I guess maybe warrants that monthly. And
Yeah, those big counties, Eagle County, even though they are commissioner meetings, they have Board of Health meetings closer to the quarterly cadence. The requirement is quarterly.
right.
Now, Eagle County's commissioners are their Board of Health. Well, we were up until the formation of this one. What happened? Why did this one spin off?
Can I remember why?
About 8 years ago.
I thought it was mandated. If it wasn't.
It was a recommendation,
Mhm.
like it was a recommendation in one of my capstone, like I did a project in grad school that recommended a reformation of the Board of Health. I think it may have been a part of when the county took over the public health department from Community Health Services. There were a number of recommendations that were to happen, and that was part of it. And then if we even remember before that, the city of Aspen used to have its own Board of Health. And that has also been kind of folded
Remember that.
into, now we have one Board of Health, we have representation from all of the different municipalities. And I think what this video talks about as well, we also have experts from different areas of the community. Right now, we've got our at-large members have a lot of public health and healthcare experience. In the past, we've had a pilot, we've had business owners. So there are, we've had mental health, someone with mental health lens. So there are a number of different expertise that can come and play a role as Board of Health members.
Great, thanks. Is that it? That's all it?
So
Are we trained?
This is my curated version of the training for y'all. And
That went very quickly and I like this.
and I would say I like it as well. I think that for me, the most valuable part of this is the discussion as well. And so I've had some initial conversations with the OPHP folks saying like, oh, it'd be great if like the recorded sections were smaller or there were options and just the requirement was to, do something and have a discussion. So if you feel similarly, that evaluation is a good opportunity to plug that.
We could do a favor for all the Board of Healths in the state if they went for this.
So this is a style that a number of different directors are doing, is just bringing it in person and doing it together. The other section that I didn't select any content from was around emergency management. Our emergency management in Pitkin County, I think, is really different than if our board was county commissioners or if we didn't have the very strong emergency management system that we do. What I will do though is in 2025, bring you our emergency preparedness and response coordinator and maybe the county emergency manager. And we would love to share with the board what does emergency management look like at Pitkin County? But I think that might be more valuable than the reported training.
Just curious, looking at these few, which I love that they're so short and they can kind of bring up a lot of conversation. Does it bring to mind anyone, like, do you have anything in mind looking at this? Because it gives such a greater perspective on everything, like what we could be doing as a board as a small improvement or a larger role, or I don't know. Did anyone have anything in mind that looking at this, like, oh yeah, we should be doing that, or let's.
I was saving it for round robin.
Oh, okay.
I noticed they don't use round robin there. We kind of came up with that when we first started forming the board. But they call it board member input, I think, or is that what it? Yeah, I think that round robin's better.
Dry.
Yeah.
Round robin's dry.
No.
Well,
yeah.
no, what,
I like
I
round
think they
robin.
called it board reports, I guess. Maybe
Okay,
that's where it
Round
comes in.
robin's better.
Okay. All right. So do we wait or do we start now on that?
We've got a couple other, if we can move the slides along.
Okay, yeah.
We can wrap up this section. Please do take that evaluation that will check you off in the eyes of the state of having completed your
You emailed that link to us?
board
Will
Yes.
do. Okay.
training. Is there a next slide that here is proposed meeting schedule. So for 2020, and keep going to the proposed meeting schedule. So for 2025, there had been a request that we move the Board of Health meetings from the second Thursday to the third Thursday. So if that is indeed the preference of the board, those third Thursdays would be January 16th, April 17th, July 17th. And then the October meeting, we would still need to do it the second or even the first Thursday in order to be able to review the budget before it goes to the county commissioners. So
This is 1 to 3 again,
1 to 3:30.
3:30.
So looking for feedback if that is amenable or if there's any other changes board members would like to see. The other piece I'd love to hear feedback on is regarding a board retreat. If there's any date that if the board feels strongly, last year the board felt strongly about not having a board retreat for 2024. In 2025, we will be doing some strategic planning, so there will be opportunities for the board to weigh in there. We can incorporate that into the standing quarterly meetings, or we can also set a separate date if that's preferable.
Quick question back to the scheduling. Sorry, I was looking at, I'm on the core board and we meet on the third Thursday of every month.
At 4 p.m.
Yeah, actually, it's at 8:30 in the morning now, isn't it?
It used to be. I thought it was in the afternoons, but maybe we better check that.
Yeah, we better check.
I have it, down for.
Because I'm at 8:30 right here. Anyway. We'll get to the bottom of that.
So the core board is either at 8:30 or 4 in the afternoon.
Exactly.
Is that preferable? Is it preferable to having it be on the same day as the core board and not on the same day as the
RAFTA.
I can answer that because I'm not on RAFTA.
Hmm.
Tori would be the one that
Tori and
answers
I,
on
yeah.
both of those, but if it stays from 1 to 3:30, that still works because then I can go to core at 4.
And RAFTA is in the mornings, so it's toss up really. I could keep it or move it. And is it just us electeds that are concerned about, or is this for other people as well? And who proposed changing it? Did I propose it? Oh, that was like 2 days ago.
Oh, it was like months ago.
Yeah,
You wrote it down.
Why did you?
Right,
want
it's
to
just,
change
it's
it?
the second Thursday is my absolute busiest day of the month. But really it's, the third doesn't make a big difference to me. So if that's our only choice,
Too.
that's usually a big day too. I guess I'd prefer to move it to the 3rd because I'm going to be chairing RAFTA next year. And so it'll be harder to miss and harder to pivot from that to this. So maybe it would be better to, I'm amenable to it when we can, core seems to fit somehow. Either
Well,
way.
And that would free up a different Thursday for me.
Yeah, there you go.
Are there any, either online, I don't know, we've still got Krista and Barry online, or in the room?
Right. They may have a,
Does the 3rd Thursday, is that?
is Krista still there?
For anyone else?
Very.
Barry's there. Krista's gone. Let me see if I can text her real
I'm gonna
quick.
say, just because of plans I've already made, I can't personally make it to either of the first 2. I could probably zoom into the first one, but not the second one. And then I can make sure that the 3rd one I can come to, the last 2, but I just wanted to be upfront about that.
Ski trip.
Yeah.
Yeah.
Well done.
Wait a minute. We want to hear about this.
Well played.
Yeah.
I like it the way it is
Planned
because
early.
I'm on the Wheeler board
I
that
was like,
meets
no, I have the Board of
yesterday.
Health in the second
So I've got
week,
both
I
of
have
my
to go to
meetings,
3rd.
major meetings together. This makes it more difficult for me to travel.
So that's harder.
Yeah.
So the 3rd Thursday would be preferable.
I like to keep it second.
Second.
Greg, is this something, do you want to put it up for a vote?
Yeah.
Or I can say.
I was thinking I'd just wait to hear if Krista says anything. Doesn't seem like anybody really cares other than Dr. Kurt now is
I
the
can
one.
make it work either
We
way.
can make, I
Troy
can make it
would
work
I can
either
make
way.
it work. I'll try to
Um,
do it by Zoom or something.
Krista says that we could move it and she can make either work. Okay, so it's really.
I'm totally open to.
Okay, Barry's open as well. Do we need to vote on this or just,
To make a decision.
got it?
So.
So were you saying the 3rd or were you saying better to keep the 2nd still?
I'm flexible. I would have preferred it the way it was, or the way it is.
Would you
I'm-
mind we switch
I'm
it to the 3rd
flexible.
and give it a shot? Well, can we try it on the 3rd Thursday?
Sure, let's try it.
Okay. If everyone else is okay, let's do that.
So it'll be the 3rd Thursday except for in October. We can do the. second.
After October. So after, well, you mean
So
mean
January
every year?
16, April 17, July 17, and October 9th. And then we can revisit in October 2026.
Sounds good.
okay, sounds good. And you'll send us a calendar thing, right? Or somebody will.
I bet you will receive it shortly.
Thank you. That was easy.
Great. Oh, and then just any feedback on board retreat desires to have one and schedule it, not have one?
You could 10.
Yeah.
You probably don't have yet ideas for agendas through 25 yet, but I always feel like, like the EPR thing, I think is great to bring to the board. So I'm just wondering if we feel like we need another meeting so that we don't take up meeting time with important topics that we want to hear about since we only meet 4 times a year. But I don't know how much strategic planning time you need from the board. If it would take up a whole meeting or would just be a little.
I think it would just be, and it depends on what process, it hasn't been designed yet. So. we've been-
Subject matter for the retreat. Is that what mostly you're asking
So
for?
the retreat, I would imagine, would be around strategic planning, for the most part. I think depending on the board's desire to contribute additional time, if we just worked with what meetings we had, strategic planning opportunities would probably be about an hour and a half of input out of any meeting, because there's always something else that, we need to bring to the board. We would be able to delve into it more, potentially bring staff. If we did a retreat and do some more in-depth strategic planning work, we can design the process to meet the desires and availability of the board as well. So just kind of wondering where the board desires in terms of time to be dedicated to that strategic planning. And then The timing of the retreat and the specifics, I would request that we wait to, to see when the ideal time would be to schedule that.
And you'd want to do it in the first quarter or the first half of the year?
No. It would be depending on when we got a consultant in and then when we were able to get it done. The strategic plan, we have one through 2025. We need one for 26.
Got it.
So we've got the whole year to,
So what input do you need from us?
that is the question. So usually in the board, we'll come to the board with some either prioritization, questions, or we've done SWOT analyses in the past. We've done giving feedback on potential strategies. So those would be the typical areas that the board could provide input.
At the retreat?
Either at the retreat or during a regularly scheduled
Okay.
meeting.
I was gonna say, what do you need in advance from us? Do we need to submit thoughts about, just subject matter, topics or beforehand?
Not at this point.
Got it, okay.
So we haven't designed the process. I was just wondering if there were strong feelings about additional, like last year, there were strong feelings about just not wanting to do a report. I think folks had spent a lot of time on public health over the past couple of years.
Right.
And so I can work with whatever the board desires. I can also bring this question back as we get a consultant on board and we have some process outlined, and say we can either do this at a retreat or we can do this during the meeting and see what the board wants to do.
That sounds good.
Easier if it were more specific.
Great.
Yeah.
I'll do that.
I have to say, I like retreats. We don't seem to have them so often that it's tedious, but retreats tend to give people enough time to get it all out and talk and kind of get more comfortable. So having a retreat, I think, is a good idea since we don't meet every month at this point. When you have it, leave that up to you, or you can consult with Krista and me and Kim or whomever you need to, and pull the board individually if you need to.
All right. Well, thank you for that feedback. That's super helpful. We've got some communication plan feedback, and then we've got 4 minutes and then we'll open it up for round robin here. So if we go to the next slide, I just wanted to share the potential communication plan topics for next year. So we've got radon awareness. I guess throughout you'll see the big change we've made is including the topic of climate change and the connection to health within these other topics that we're already going to be talking about. So in January, as Kurt shared, we have a radon grant. That's a really great time of year to be promoting radon awareness. March, again, we have some programmatic requirements to do some tobacco messaging then. May is mental health awareness month. And so the idea was to do something with a little bit more of a positive spin in May, and also include this connection to climate change and mental health. June, it sounds like there's definitely desire to continue to engage in some gun safety work, and whether we can additionally help promote any policies. But the thought really for June was to think about partnerships there, especially with local law enforcement, and potentially getting out somewhere where we could have more interactions with the public and engage, as opposed to just a online campaign.
Yeah, and I think we did a good first shot at that in June. I think that those are great goals.
So that's kind of the gun safety topic. July, this would be a new topic, rabies. Additionally, there's that connection to climate change. We had a lot, we had a very slow start to rabies specimens this year, but then it all came in fast and furious and people didn't quite seem to know what to do. So it seemed like that could be a really good topic for being able to promote ahead of the time when folks need that, that information. Thanks, Kurt. Yes, it was mostly bats, and mostly a lot in snowmass.
Snowmass rabies?
Snowmass bats.
Wow.
September, harm reduction, anti-stigma, and this drug take back, boxes that we have here. I know, Dr. Kurt, you always share with us the National Drug Take Back Days events that we don't participate in here locally, but we do have that year round, and we could do a better job of promoting that. And then, as always, our respiratory illness, that brings us from October through March of every year. And we would include also that climate change lens. So those are the thoughts. Happy to hear any feedback that Board of Health members have, and then also wanted to share that I think that the letters to the editor, or call it public health columns, that folks have written this year, have been received very well. Linda, thank you. You wrote our last one. I think that there would be the opportunity to reach out to the Aspen Daily News, and if we have more than 4 board members willing to write a column next year, I could propose more than four that we do quarterly. So my thought was to send around a sign-up sheet. If folks wanted to sign up for a month that they were interested in, and either a corresponding topic, or if there's something else public health related that you're passionate about, social determinants of housing and how that impacts health, or anything else that you're particularly interested in. I think it helps us achieve our goal of having the public get to know a little bit more our Board of Health and the expansive topics that are public health.
Great.
So I'll send that around. And then the one thing we have learned is they would like only one author per article moving forward.
Have you talked to them already about 25, or
No,
going to propose it?
I'm gonna see how many,
Yeah.
if we only have 4 sign up, then we don't really have to talk, but if we have interest, I get the sense that
Quarterly,
they would be open to it
for quarterly. to
For-
continue.
for more than
Oh, for
quarterly.
more than, okay.
Okay, great.
And that we can pause there and go to round robin.
And round robin might inform this somewhat, perhaps.
Sure.
Okay. My favorite time of the meeting is round robins, where everyone has a chance, board comment or board member reports. Is there anything anybody wants to bring up? I don't always want to go first, but I'm willing to, but
I just was thinking that with the entrance to Aspen conversation, that evacuation is a public health issue. And so just to maybe have a conversation about where we are now and how limited we might be as far as a mass evacuation of our communities, really. And kind of how that could be something that we could,
examine,
yeah.
just examine it. Yeah, I think that'd be worthwhile.
I do know that Jake Anderson from the Aspen Volunteer Fire Department is working on evacuation routes and plans right now, because apparently there isn't one.
Well, yeah, that could be good to have one. And just, like we probably would want to just gather information, like what is it currently? Do we have a plan? What is the plan? How can we make it better? That
What's
sort
the
of thing.
likelihood? and
Yeah.
What direction would we go, and all those
Right.
sort of
And
things.
what are the scenarios where we might have to have one, wildfire comes to
Right.
mind, but could be other things, so.
And we can definitely cite the Ruidoso and the Jasper fires from earlier this summer.
Mhm.
Sure. On that topic, it's a timely topic. I think it's important. It's kind of become almost slightly political as we just argue about entrance to Aspen and bridges and things like that. But it's worthwhile, and there's probably a lot of data there, and a lot of people would weigh in, which is great. I can tell you that we had a report yesterday that the Forest Service wants to do a big controlled burn to the west of us, specifically in a large swath near Hay Park up in Capitol Creek area, because that would be the fire break. Because they did a test and saw that a fire that broke out in Redstone could be at Snowmass Village within 12 hours under the conditions of their modeling based on what's going on. And so they're thinking about fire breaks points that far out, and there might be other conversations like that
Right.
coming along. So it's a worthwhile conversation, certainly. Thank you. Any other, Linda, got anything? Moving around the room, Dr. Kirk.
I agree with Susan. There should be more exits to the city. And I think in the past, things like the Rio Grande right of way, which I think was 100 feet wide, could have been utilized in some kind of an emergency exit. At least maybe that could be rehabilitated in the thinking of the community in the future, and let's be brave
Right.
enough to condemn that and make it into a kind of an emergency. There's also a place up on Red Mountain where exiting to the
Right.
west was blocked off.
Now you're already
So-
solving the problem. I'm just trying to talk about the topics here,
Okay.
but I agree with you. And yes, I agree with you.
I agree.
So
For
fire-
public safety, it
Exactly.
would be a disaster because we're sort
Right.
of in a box canyon here.
Other topics.
No, I'll just want to comment more on that and tying our evacuation plan to emergency preparedness. I mean, I think that's obvious, but I
Right.
just need
Yeah.
to say it.
Regardless of what direction and where we head, how prepared are we to?
It's all tied in.
Others, Kim? You can weigh in. You're a legitimate.
Other
member.
topics of
Uh,
conversation or?
yeah.
Maybe we'll skip me for now.
You skip me. Okay.
As far as air quality, one of my observations throughout the last couple of years is the increased of traffic on McLean Flats Road and Lower River Road coming into town.
Hmm.
And two things about that, I think that the air quality in that, part of town, it would be valuable to actually evaluate that one area, that one street, because it's just constant traffic on that street. And also,
Yeah.
well, probably has nothing to do with it, but the light at that street with the Highway 82 and Cemetery Lane. It used to be allow 4 cars and then 2 minutes, and then 4 cars, 2 minutes, and then they went to 10 cars in 2 minutes. And now it's back to 4 cars when the
Yeah.
traffic is even worse.
The
So-
cemetery lane stoplight.
Yeah.
Yeah. And
But the air quality.
notice air
ones,
quality as a result. Yeah.
Along with the airport business center and the airport, I think that's another way, entrance into town,
Right, sure. People are thinking of it as a legitimate daily, program. We
Yeah.
talked about that yesterday as well with the Elam trucks.
The Michigan turn.
Oh, there's that coming.
I do have a comment, actually.
Okay, yeah, go ahead.
I just wanted to comment on the psychedelic, are you still here? Oh, yeah, okay. I didn't know if I got it. The proposal to help collect data, I guess. And I mean, from a physician point of view, looking at, this is a similar thing that happened with marijuana, and from a public health perspective, which is the lens that we all need to keep, is looking at the health of the community, and collecting data is always good from my point of view. That's always a positive thing to try to help create change and steer things in directions of helping people. We are seeing, this momentous event where a recreational drug is being used as a medication. And when there's new medications brought to the world of medicine, there's a lot of studies that are done and safety studies that are done before they're brought in. And now we're looking at mass use of a recreational drug that definitely has benefits in very specific situations to help people, especially with treatment-resistant depression. There's a very specific segment of the population and patients who will benefit from this, no doubt. But the potential for harm as well, I think, is great, especially on a mass level, and becoming in these centers, which we don't know, everything is attempting to be done in a safe level, but my talk that I did, I can't remember exactly when that is, but I learned a lot in that. And you know, the dosing for using a psychedelic for treatment-resistant depression is like 10, 20 milligrams, okay? And then you give a second dose 2 weeks later and see the help out. What's going to be happening, I believe, in these centers is a kind of a massive single dosing with like a long 6-hour period of time of helping someone go through this huge trip and trying to make it as safe as possible in these centers that are going to be developed and starting in a few months from now. And so we don't know exactly how all that's going to pan out, and how, yes, it's the intention is to make it as safe as possible, and really appreciate the support and locally, as we know that this is supported locally. But from a medical point of view and a physician point of view, I want us to be very cautionary in terms of partnering or supporting. And yes, data is really important, but if we want to collect data for the community, you know, this is kind of our job, and I'd like it to be a little more separate rather than creating strong in terms of putting out opinions on it.
Right.
You know, when marijuana became legal, of course, that was a momentous thing that happened, and there was a lot of harm done, especially in the youth population, from my point of view, and could have been done in a lot better way. So we're hoping that this way, a second recreational drug coming into the masses will happen in a safer way, especially for kids with developing brains. And so that's my point of view. And I always I'm taking a very cautionary step in all of this.
Thank
And
you.
I would advise the board to remain with a public health lens on it.
So it sounds like you're saying collecting the data is probably a great idea. Advocacy is not someplace we would go.
I would just say, you know, as a board, you would all want to discuss if you're going to be taking positions on this publicly. It's obviously not our job necessarily to be taking positions on things, but to keep the community safe. And so that's where I see data as important, and I like the idea of it, but I would want to, you know, do it in a legit way and for for reasons that we, through our public health lens.
Right. Thank you. I think
This is Dr. Giesel. Can you hear me?
Oh,
Yes.
Krista, Dr.
Yes,
Giesel,
hi.
jump in.
I just want to, again, I think that we actually have the most data on this topic from the VA where I work, and in the use, again, of veterans with very severe PTSD, where, again, there's a lot of counseling that gets done. They reach a certain point in their counseling where things cannot proceed. Perhaps the medication at that point is helpful, and then therapy proceeds. This is not exactly what we're seeing in the models that are being proposed in the state of Colorado. And I also want to caution us, I completely agree with everything that Kim has said. When you're collecting medical data, it is not just doing a public health or a public survey, written by the Board of Health. Like, we want good, sound medical data around this. And I'm not sure that surveys that we put out or partner with people that don't actually have the medical expertise to be doing the surveys are going to achieve that legitimate data that is going to be meaningful on this topic.
Thanks, Krista. So what I might take away in this is that it's worthy of a discussion, further discussion, and a meeting with some real study in preparation beforehand. And if we can leave it at that, we'll keep going. Does that work? Yeah. Okay.
The Rocky Mountain Poison and Drug Center has functioned very well. Last year, I got involved with Shireen Banerjee, who's the manager of the Poison Center of Farm D, Chris Hoyt, who's the director of the Poison Center, and Andrew Monte, who's the associate director. And from what the information I had here from the Aspen psychedelic meetings, going to doors, seeing what was happening and working with them, we presented a symposium at the Montreal meeting of the North American Congress of Clinical Toxicology. It was standing room only because everyone was interested in how this is playing out and being responsible. So my feeling is, from working with FDA before, I was an FDA regional medical, responsible oversight. I don't think anyone is advocating anything reckless. And there are going to be some growing pains. There are.
Thank you. So I think, okay.
I don't think anyone is advocating it to be reckless, but I do see that the doses that are going to be used are 6 to 8 times higher than the doses that are
Let's save that,
study.
or let's
So
save
The
that when we
research
bring
that's
it
been
back.
done in the University of Colorado reported 2 weeks ago, lists specific, very responsible doses. And they're not using mushrooms, they're using the psilocybin. It's chemically manufactured. So it's just like a drug.
Got it. Thank you. Okay, more later on that. We're going to keep
I just
moving, if
have
you don't
one
mind.
question
Go
about,
ahead.
is there anything that we can do proactively to kind of get communication out around safety for youth around the psychedelics? I mean, if we
It's
could,
not advocated for anyone less than 21 years because the growing brain.
and so just information like that, that we could put out
Absolutely.
beforehand so
That's a
that we're
great
kind of
idea.
ahead of the game.
I think it's a great idea.
Right, yeah, thanks.
Are there,
Liz?
with the introduction of all these new centers or all the changes that will happen in the new year, are there systems in place to do this, to begin this data collection, to monitor the safety and efficacy and of what's going to happen? Are we talking about data collection from the past? Or are we talking about data collection for the future?
Wouldn't that be,
We can
wouldn't that
ask-
be something we discuss? I don't want to have the conversation now because we're out
Sure.
of time
Okay,
and I still have things to talk about. But this is important and it should be included in a conversation. Is that right?
Yeah.
And sorry, I can't recognize you. We got to keep moving, but I think you see the importance of it.
Retreat.
Yeah, maybe it's at a retreat. Is that okay if we
Yeah.
keep moving? Okay, thank you. I just was going to bring up things on my mind. And one, I think Jordana saw it. I don't know if Dr. Levin saw it. I was asking about bicycle accidents and ER visits due to bicycle accidents. And I got a report from Jordana that I drilled down a little bit on from the Colorado Department of Public Health, I believe. And it was specific to emergency room visits for bicycle accidents that did not involve motor vehicles. So in other words, they weren't collisions with cars, just bike accidents. And Pitkin County was between, I'm going to say, 2 to 8 times higher incidence, but more than 2 was pretty rare. I think we have a dramatically higher, whatever their measurement was, Pitkin County is much higher. We have more bike accidents. It could be, we have more cyclists, more recreation. Well, it's all bikes. They didn't break it down. So we can't blame just e-bikes, but, and the reason I asked is on our very own staff at the county, I won't name names, but high up officials that if they get taken out on a bike again, because it's happened multiple times, it's like we could lose our senior staff. So I'm thinking, okay, it's something worth contemplating, and maybe it's a public health issue. If we have a much higher incidence of bike wrecks here, only because we've got so much target-rich environment, maybe that's a topic. So that's one, and I'm only going to bring it up, and I don't know if we can decide on it now. Another one is highway safety. Only that Highway 82 now, the average speed's probably 70 plus miles an hour. I've been involved a lot in wildlife collision, advocacy for crossings, safe wildlife crossings, things like that. And that's a safety issue. The average cost, they say now, of a wildlife vehicle collision is about $70,000 if you include the response from first responders, the mortalities, the property damage, and the value of the wildlife. It's an expensive thing. And I'm wondering if there's a place for that. Maybe it's just looking at the highway danger. Finally, climate is involved in a lot of things we're talking about. When we announced a climate emergency in 2019, and I was chair last, we asked for a report on climate action plans from every department whenever they came to us. And a lot of great stuff came from that. So that's important also, the climate implications. Maybe that's a mental health issue right now because there's a despondency tied to people who think about climate change too often. It might be something worth contemplating in a Board of Health setting. Those are my suggestions, and they may be kind of out there, but I wanted to throw them out since this is our time. And I don't want to have round robin at the end ever again. Thank you. And when's our next meeting? 16th.
Might be fun to just have a meeting that's a round robin.
Well,
Just all
maybe that
inclusive,
happens at a
so you just,
retreat.
Like think about
We
things
could dig
and
into
talk
these
about
things.
'em
Well,
and,
that's where the
you know.
retreats are so good.
Yeah.
And we do it in a fun setting somewhere, Is there anything else to talk about? We got it all out there, whether food for thought. I don't know if you wrote it down or not. I tried to. And we can pick it up with the next one. And I need a motion to adjourn, I think, don't I?
So moved.
Second. All in favor? All right. Thank you all. That we're out at 4 minutes over time and I've got to run to my next meeting.
Nice job.